Hi everyone, I'm Ed Baker. Welcome to the Addiction Recovery Channel, or ARC. I am your host producer. I'm very happy, I'm very pleased to be here today with our two distinguished and accomplished guests. We have Kevin Black and Christina Nolan. Welcome to the show.
Thanks for having us.
Thank you.
Yeah, thank you so much for being on the show. Thank you so much for taking the time out of your very busy schedules to be here. Kevin Black is the resident agent in charge of the Drug Enforcement Administration here in Burlington. He was appointed to this position in February of 2018. He had previously served with the DEA at their Pittsburgh and Rochester offices. Kevin also has a history of being a commissioned officer in the United States Marine Corps. Thank you for your service, Kevin.
Thank you, Ed.
And Christina Nolan. Christina Nolan is the United States Attorney for the District of Vermont. Christina came to us following her tenure as Assistant United States Attorney also in Vermont from 2010 to 2017. Ms. Nolan she enjoys the distinction of being the first female U.S. Attorney in the District of Vermont. Thank you for being on the show.
Thank you for having me.
Yeah. I'd like to begin with you, Kevin. On a personal note, you know, as I understand it, you graduated from SUNY, State University of New York, with a master's degree in public administration.
I did.
And soon thereafter began your career with the Drug Enforcement Administration. So, for a young man, with the potential to fill many positions in many different areas, I'd like you to talk a little bit about what is it or what was it about this particular role with the DEA that attracted you?
Well, I became interested in the drug trade as a Marine deployed to Afghanistan. In 2007, I was in Jalalabad in Afghanistan and saw the poppy fields there. And in my discussions with the Afghan nationals and with Army Special Forces, I became really interested in the international drug trade and came back from Afghanistan with a passion for DEA and applied as soon as I got back.
Oh, I didn't know that. I didn't know that. So yeah, you were deeply affected by your experience in Afghanistan.
Yes.
That's really wonderful and well said. And I see here that one of your main roles is that you supervise DEA special agents who are involved in large-scale drug trafficking operations within Vermont.
That's right.
We'll take a closer look at that in a couple of minutes. And basically, really the same question for you, Christina. As I understand it, you had graduated from Boston College School of Law. You held a couple of different positions, and then you set your sights on Assistant United States Attorney in the District of Vermont. Knowing fully, what a tremendous responsibility that was. What was it that motivated you? What motivates you to hold this position?
Well, I think it's two things. I was born and raised in Vermont on a dirt road in Westford, and I feel awfully lucky to have grown up here. I didn't do anything necessarily to deserve to be born in Vermont and have the wonderful childhood that comes with growing up in Vermont. So this was an opportunity to give back to the state I love and to serve Vermonters and to help keep them safe every day and to promote justice for them and to fight for Vermont victims. So I think service to the state of Vermont and by extension to the country, because many of the cases we do have nationwide and even international implications. But the other thing about being an assistant U.S. attorney and even now a U.S. attorney is you get to go to work every day and try to promote justice. And for me, there's nothing more motivating. It's, I think, a very high calling. It comes with a lot of responsibility. But prosecutors don't do cases to win. They do cases to promote justice. And that's a hard job. It's a solemn responsibility, but it's one worth living for.
Wow. Very, very well said. It brings to mind a quote, the great Reverend Dr. Martin Luther King Jr. said, "The arc of the moral universe bends slowly, but it bends toward justice." So thank you for helping, both of you, to bend that arc. And I think you mentioned safety. Thank you for keeping us safe. We were chatting a little bit about this before the program, that every day I spend my life doing the things I want to do and have to do and are interested in doing, and I feel safe. I don't feel threatened. Without the roles that you perform, I don't think it would be a safe state.
Well, it's that's our first priority, is to keep Vermonters safe, and I think many Vermonters do feel safe. In many places, this feels like a safe state, but I think others feel unsafe. And I want to give a lot of credit to the people in uniform who are out on the streets every day, actually making dangerous arrests, conducting investigations of dangerous people. Kevin has brought a tremendous amount of energy to the DEA in Vermont. They're doing incredible cases, and his agents are out on the streets putting themselves in harm's way every day so that we can feel safer, and I enjoy the benefits of that too.
Yeah. Thank you. Well said, and thank you. Let's start with that, Kevin. Let's talk a little bit about trending in Vermont. What do we see as drug trending in Vermont? What are you seeing currently?
Well, what we've seen over the last year in Vermont is a decline in opioid overdose deaths, about a 10% reduction we've seen so far this year.
Nice.
So we're definitely heading in the right way. It's way too soon to declare victory, but we like the way things are going with opioids. We need to see that further reduced. Yeah. We're also seeing an increase in demand for methamphetamine in Vermont, so we're keeping a close eye on that.
I think I was at a meeting recently with a representative from the high-intensity drug trafficking area, and he was citing the same trend, that there's an uptick in methamphetamine seizures.
There is.
And there's also have been a few overdoses. What do we attribute that 10% decline to? Do we know?
Well, I think it's a lot of factors. One thing, I think the most vulnerable among us, unfortunately, are gone. We've lost a lot in the last few years. Also, the availability of naloxone. Everybody has it. All of our agents carry it all the time.
Nice.
So it's those types of things in combination with demand reduction efforts. So I can't attribute the decline to just one factor.
So naloxone, demand reduction efforts. How about what they call low barrier access to buprenorphine?
Well, I think medically, the access to medically assisted treatment has definitely been a factor as well in Vermont. There's effectively no waiting list for treatment.
Right, right. Really, really good. Really something to be proud of as Vermonters. I mean, we are all in, from the governor, straight through all levels of government, healthcare, a lot of public, kind of grassroots kind of community organizations. We're a model, and not to diminish the tragedy of what we face every day, but we are a model in making progress in the face of great adversity. I had noted a couple of different cases that I came into contact recently that I think I'd like to focus on, because I think they're emblematic of what's going on behind the scenes. One was in Bellows Falls. There was a person in Bellows Falls who was arrested possessing 2,500 doses of fentanyl and an assault rifle. You want to speak a little bit about that case?
Yeah, unfortunately, it's not as uncommon as folks might think. This was a person who had multiple felony convictions already. He should not have been possessing a gun of any kind. Forget about in connection with trafficking that much fentanyl, which is enough to kill tens of thousands of Vermonters.
Wow.
So very serious situation. I would add to what Kevin said. I agree that our demand reduction efforts have made a difference. I agree that the availability of medically assisted treatment is crucial.
Yeah.
I agree that naloxone availability is crucial. We just got naloxone and got trained on it at the U.S. Attorney's Office.
Nice, good for you.
Because we have so many witnesses coming through who suffer from substance use disorder, and even defendants. But I want to say that these enforcement efforts in which somebody is held accountable, given serious consequences for supplying that amount of fentanyl in Vermont, taking that much fentanyl off the street. That supply reduction and the efforts of the law enforcement agencies and prosecutors to reduce supply, I think, is also part of the reason we're seeing some positive movement in the number of overdose deaths, but as Kevin said, we have a long way to go. But my office, if you possess an assault rifle and 2,500 bags of fentanyl, you should assume you're gonna come to federal court.
Right.
It is very dangerous conduct, and the very worst can happen as a result of that.
And obviously, this is a person that is, preying on one of the most vulnerable populations in America today.
Right.
People with opioid use disorder. And that has to be stopped. We have to stop that. The other notification I became aware of today was the DEA's efforts to track fentanyl, counterfeit pharmaceutical opioids containing fentanyl. So it's my understanding that the Drug Enforcement Agency actually has a program to track the distribution of this type of illicit opioid.
That's correct.
What can you explain that to us? Because I think that's really interesting, and to get that information out to the public so they know.
Well, what they're trying to do with counterfeit tablets is get people to use those drugs thinking that they're taking something that was legitimately prescribed because it demands a high value on the street.
And it could be Xanax, Zoloft,
Yes.
OxyContin. It could be any one of a number of different pills that people may be used to acquiring on the street.
Exactly.
That have an opioid, like a morphine-based opioid,
Yes.
but instead have fentanyl.
Yes.
At really an unknown dose.
Exactly.
Okay.
And to talk about just how egregious and wrong that is a method of expanding your opioid addicted population. So people think they're getting a drug that they probably shouldn't be taking. They definitely shouldn't be taking if they're getting it illicitly, but they don't realize it's fentanyl, and they don't realize it's an opioid. That such a high percentage of people can become addicted after their first use.
Yeah,
And they
yeah.
thought they were doing something that it was more possible to do recreationally.
Yeah.
And the other, just along these lines, I just had a case I reviewed on my desk yesterday where there was fentanyl and cocaine. And if a user thinks they're getting powder cocaine, again, in no way do we think you should be doing powder cocaine, but it's very frightening to think that somebody would use that, not realize it had fentanyl in it, and they're not going to have naloxone on hand, perhaps, to reverse an
Exactly.
overdose.
Good point. Really good point.
Yeah.
And the way that I understand it is that really all heroin east of the Mississippi is contaminated with fentanyl. And this is
Basically,
I would definitely agree with that. I mean, to use any heroin that's available on the street is literally to play Russian roulette.
Yeah, and this is like a supply side driven phenomenon. It's the suppliers that are driving this. It's not people on the street with opioid use disorder saying, I want fentanyl. It's people, international crime organizations, who can save a tremendous amount of money and labor by producing fentanyl rather than producing heroin, that are just changing the market dynamics for profit.
Exactly.
At the cost of literally tens of thousands of people every year.
The cartels are responding to an opportunity that they've observed in the market, absolutely.
Wow.
Yeah.
Preying on Americans.
I agree.
Well, thank you. Thank you for your efforts to protect us. And this is a battle that will probably go on into the foreseeable future.
I believe so, but we will, Vermonters should know we will not give up, and they should know how closely we work together, and the way that law enforcement works together, and the way that people across disciplines work together to continue the fight. And I think we are seeing some progress, but we're still highly motivated and know we have a long way to go.
One of the things that I see, I attend a few meetings. I'm a little bit active in the field, and I just see a groundswell of motivation on many levels that I've seen groundswells like this before, but I've never seen traction like this before. It seems like deeply motivated, committed traction to really keep doing something about this going forward. And that to me is extremely encouraging. I'd like to kind of shift a little bit to the nexus between sex trafficking and opioid addiction. Would you like to begin to
Sure.
tell us a little bit about that?
Sure. We're really beginning to raise awareness when it comes to this issue. Human trafficking is in Vermont and across the country and all over the world, but no less in Vermont, a component of the drug trade and particularly of the opioid trade. And we've identified dozens and dozens, probably hundreds of suspected or confirmed victims of human trafficking right here in Vermont. They tend to be young, drug-addicted, opioid-addicted individuals, sometimes children, who are being compelled, coerced to engage in sex acts by drug dealers who are using coercion in the form of physical violence, sexual violence, but also withholding drugs from these addicted individuals, these young people, these vulnerable people. These victims tend to have had trauma in their histories. This is happening in Vermont. We want to raise awareness. We at the United States Attorney's Office and in the DEA will investigate and prosecute these individuals and seek very serious consequences. We just, with the help of the DEA, as the lead agency, convicted a man named Brian Folks who had trafficked dozens of young, drug-addicted, vulnerable people with trauma in their past. At least one of them a child, and he's looking at a very significant sentence come sentencing in February.
Congratulations.
Thank you. Thank you.
And I also understand from that case, I think in order to prove trafficking, you need to prove coercion, force, or fraud.
Correct.
And a legal definition of coercion was expanded to include the provision and withholding of opioids?
Right. So if it's a child victim, you need to just be able to show that the defendant had the opportunity to observe that he was trafficking a child. Mm-hmm. For coercion, and sadly in the Brian Folks case, there were all sorts of forms of it, including rape, violence with a gun, beatings. I know it's tough stuff. It really is, but we need to face it and fight it. Yeah. But one of the other things he did is withhold drugs from people who were young people who were in terrible withdrawal, to coerce them into having sex with his clients.
Yeah,
that counts as coercion. Yes, it does. So found the jury to vindicate the victims who testified about it.
You know, and that's, I think, a major move forward. I think I read somewhere one of the other techniques that these sex traffickers use is the threat of administering Narcan. So I can force you into withdrawal if you don't do what I'm telling you to do.
Wow.
Which is, it gets more sinister the closer you look at it. One of the things I just noticed was, I think when you began describing the Folks case, I kind of recoiled a little bit, and you said, it's hard stuff, I know, but we have to face it. Mm-hmm. That was really interesting because it happened right here in our little setting. Mm-hmm. And I think that's emblematic of what happens on a cultural level and a societal level. Mm-hmm. I think people recoil from that kind of information and go on with their day, and we don't see it. So, we don't do as much as we should be doing about it, because it's interesting. It's difficult to look at. It's painful for us.
Yes, and on the flip side, though, I would say people are coming together around human trafficking in a way they never have before. We have the Vermont Human Trafficking Task Force, which brings together public health, clinicians, social services, my office, the Attorney General's office, law enforcement. Nice. And we're all working together not just to bring serious consequences to offenders. We want to have a victim-centered approach to investigations, but also to identifying them and getting them support and services and empowering them. So people, just like with the opioid crisis, people are united and working together, I think in a way never before. I think we're ahead of the curve in Vermont. So as hard as it is to face that it's happening in our state, and it can be hard, I think people should take heart in knowing that we're working together and we're focused on it in a way we never have been before. And I want to give a lot of credit to the Drug Enforcement Administration, which they worked night and day on this trial with the victims. A special agent worked night and day with the victims. They trusted him. He was patient with them. They had a good relationship with him. And so law enforcement understands this victim-centered approach, and they take seriously the human trafficking angle of the opioid crisis. And I think we should recognize that, because it doesn't go without saying you're focused on drug trafficking, but you are taking on the human trafficking component of it. So,
I wasn't aware of that.
night and day they worked on that trial.
Would you like to talk a little bit about that and what that was like, or just elaborate a little more on that trial?
Not just the trial. The case took place before I arrived in Vermont. But the facts of the case really were disturbing. The more you dug, and when I first arrived here, they were kind of preparing for the trial, and it was a tough case. I saw the effects that it had on our investigators and the intelligence analysts that worked on that case and reviewed the evidence. It really was terrible stuff, but it was work that had to be done. It was important work. So we look for those types of cases at DEA, and we really value that work, and it was a great case.
And you obviously have some people who are trained in dealing with victims and engaging victims and helping them to feel more comfortable in bringing out the facts of the matter.
We do. We do at our office. We have a victim witness coordinator who's wonderful, and she worked with these victims night and day. But we really appreciate having law enforcement officers who are so skilled in developing a rapport with victims and making them and their health and well-being the centerpiece of the trial prep.
Mm-hmm. We'll stay on this for a little while longer. From what I understand, the victims themselves suffer from a variation of Stockholm syndrome, where they kind of may see the victimizer as loving them, mm-hmm. or caring for them or protecting them. That may be combined with a threat of, if you tell anybody about this, I'll kill your entire family. I mean, there's all kinds of coercive measures that go on. So, and without a victim, there's no crime. So you have to have that statement from the victim is absolutely essential. And I think people who perpetrate these kinds of crimes, spend a lot of time silencing victims. So I'm really I'm impressed that your agency has taken the time to really take a look at how to engage these people and bring them forth so we can prosecute human traffickers. Mm-hmm. So thank you. I guess I'd like to switch gears now, because we've looked at drug trafficking, we've looked at human trafficking, we've looked at some of the tragedies that we face in Vermont and the great work you're doing to control this and reverse it. It was new to me as I researched both your roles. It was new to me that both the Drug Enforcement Administration and the U.S. Attorney's Office are active in prevention work. Yep. Really trying to prevent people from becoming involved with drugs, and also to encourage the appropriate, medically based treatment for people with addiction. Let's move into that, because I just really think that's encouraging going forward. As long as there's demand, there can be all the interdiction in the world, but there'll be some supply getting there. So you seem to understand that we have to work on many different levels. Mm-hmm. Interdiction, law enforcement, but also prevention. Mm-hmm. And encouraging treatment. Would you care to begin to speak about that a little bit?
Start me.
Yeah. So, at DEA, we look closely at the economics of crime and what causes people to distribute drugs and demand these drugs. And we saw several years ago that it was the availability of unused, unwanted prescription drugs in the home. Is where a lot of people were starting with these unwanted drugs. So we started our Take Back program. We do them twice annually. The first one was, I believe, in 2009, and we've done them twice a year ever since. So we just concluded our 18th event just a couple weeks ago.
In October?
Yes.
And what was the, so if for this, we know that many opioids and other types of psychoactive drugs have reached the street via people's medicine cabinets.
Yes.
So you have a prescription in there that you don't take anymore because you don't have any more pain, but there's 24 oxycodone in the bottle.
Sure.
And, you know, it may be a babysitter, it may be a painter, it could be your child, it could be anybody could come in there and see that and take that and get it out to the street. So we know that has been historically a major source of opioids. So this October, how many pounds of pills, of pharmaceutical pills, did your program succeed in getting out of people's medicine cabinets?
So the DEA and our partners collected over 6,700 pounds of unwanted drugs for this last event. So it's 70 locations across the state.
Wow. And isn't that a record?
It is a record for Vermont, yeah.
6,700 pounds, that is incredible. Yeah. And what was it in April?
Before that, we collected 6,500 pounds.
Incredible,
yeah.
Incredible. You know, I think, unless I'm mistaken, I think I was reading somewhere that the nationwide total was over 80 tons. Some mind-boggling figure. Now, we don't know how much of that were psychoactive chemicals, but we know a lot of that, a significant portion of that, are chemicals that could have been on the street, could have been at parties, could have been sold.
Absolutely.
You know, so thank you for that. Yeah, we're really doing well with that. And I think if you look at the Centers for Disease Control data for 2018, for the first time, the number of deaths specifically attributable to prescription opioids dropped. A couple of thousand less people died in 2018. So that is definitely contributing to that.
I believe so.
Yeah. So a little bit of success there will go a long way. That'll get us really motivated.
We are huge supporters of the program.
Yeah.
And I think it's making a real difference.
Yeah, very, very good. Incredible. What about Red Ribbon Week? Do you want to talk a little bit about that?
Sure. So Red Ribbon Week started with the unfortunate death of one of our agents, Enrique Quique Camarena. Was assigned to our Guadalajara, Mexico office. He had been there for about 4.5 years, and he had had a lot of success investigating the drug cartels in that area. In February of 1985, he was exiting the consulate, walking to his truck on his way to meet with his wife for lunch. He was abducted in the parking lot and tortured over a 30-hour period. They found his body outside the city a month later. Later that summer, his high school in Calexico, California, started the first Camarena Club, where they celebrated Kiki and his sacrifice and a drug-free lifestyle. The Camarena Clubs grew nationally into Red Ribbon Week and the Red Ribbon Campaign that we still celebrate today.
Wow. That is tragic and also beautiful to remember him in his service. So I want to recognize that, and also to underscore the idea that you know, to protect and serve, you really do protect us. And I think the general public should really take note of that, and really appreciate that, and get behind both your offices with whatever kind of support you need from the community. Along those lines, at the end of the show, we'll have a couple of phone numbers on the screen of numbers where people can call if they have any suspicion of human trafficking.
Yes.
So we'll get that message out. Now, along the lines of prevention, I understand that your office is supporting a public service announcement with Justin Goulet. You want to talk a little bit about that?
Yes. So one of the things I really wanted to do upon becoming U.S. Attorney is get involved in prevention efforts, because we do need to reduce supply of drugs, and that involves investigation and arrests and accountability. But you can't arrest your way out of the problem. It's a cliche, but it's totally true. You can't arrest your way out of the problem. So I wanted to find a way in getting involved in reaching people who may not, young people who may not have taken the first risk, and convincing them not to, and also getting to people who may be using or know somebody who's using, and encourage them, let them know that we're all in this together, and there is a way forward that can end in happiness
Yeah.
and a drug-free life. And
Yeah.
the way we did it is I teamed up with an incredible former defendant of mine, a man I prosecuted for drug trafficking and gun crime, named Justin Goulet, who's gone on to make an incredible recovery. And what we're doing, I really think it's a message of hope. There is a lot of doom and gloom in this discussion of the opioid crisis, and there's some cynicism. But I think I don't think we focus enough on the success stories. He's had an incredible success story, has a federal conviction, but his life, he's made a total turnaround. He's an inspiring person. And we teamed up, he and I, to sort of tell the story of his life in 9 to 10 minutes, and we're taking it to young people, anybody who will listen. And we're showing the film and interacting with the audiences. We have 2 schools this week, and we're going to be at the Burlington Community Health Center too.
Oh, I think that is wonderful. Why don't we just take this opportunity to show a brief segment
Sure.
of that actual video?
Sure. I think it's important for law enforcement and people like U.S. attorneys to stand with recovering addicts, even people they've prosecuted. I mean, that's a very unique position he and I have been in. He does have a felony conviction because I made the very solemn decision to decide to charge him with a felony. He accepted responsibility. But even though we've had to stand on opposite sides of the aisle, literally, we came together, we bridged that gap, because going forward, we know that we want everybody to find the kind of recovery, the freedom from addiction that Justin has. I know that the more people we can inspire down that path, the more likely we are to win this battle. You never know when Justin's going to write to you. So he has written to me sort of randomly off and on, and I love it. I love getting updates from him. So it's entitled 3 Years. It says, "Good morning, Christina. Today is a special day for me. 3 years sober. I know that I've told you this before, but I honestly feel like I would not be here today had I not met you. Thank you for holding me accountable when I needed it, and for giving me a chance when I felt like I didn't deserve one. I am grateful for all of the difficulties that I have faced in my life, including my arrest. Those events have truly shaped me into a better human being. I am kinder, more understanding, and capable of empathy, having passed through some pain. I value every opportunity today to help those that are struggling, hoping that it will make a difference in fighting this epidemic. I appreciate your camaraderie and friendship in the effort to make this world a better place. I look forward to seeing you, Justin Goulet. P.S. I rewarded myself by purchasing a muscle car. It will give me something to look forward to this spring. I may need some help getting out of some speeding tickets. Just kidding. All the best to you and your family." So that's the email. It's pretty special, actually. You had no criminal record.
No criminal record.
No exposure to the justice
No
system.
exposure to the justice system other than...
And you find yourself in federal court.
Yeah. I don't think I really understood the ramifications of it until I sat in that little room with my lawyer, and he came in and said, "Boy, you got some bad stuff here." And I said, "So what's that mean? I'm gonna do like a couple weeks?" You know, but I think there's some comfort in knowing I had done what I had done, and
Yep.
you know, there's a price to pay for your actions when you do that stuff.
I was so struck by we met almost immediately because you immediately accepted responsibility.
Yeah.
And I'm like, oh my God, I see such a big heart, such a smart guy, and such a genuine guy in there. And that was, really early in your process too.
Yeah.
There's so much cynicism in this opioid crisis.
Yeah.
There's so much doom and gloom.
Yeah.
I reject that because we're alive, we can make a difference.
Yeah. There has to be a balance of accountability and giving people second chances, and there have to be options available for people. I mean, one of the most amazing things that happened to me is that I was able to go right into a long-term treatment facility. So I got, 9 months of behavioral modification. There's just not enough of those long-term treatment centers around. Going to a 28-day rehab is honestly not enough time for someone to develop the skills to stay sober.
You were talking about the role of a prosecutor, and it's really, you've got to take each person on their facts and try to do justice by them.
Yeah.
And what I'm most proud of is a case like yours where we were able to find a resolution for you that gave you another chance to be the person you are again. I don't think there's anything I'll ever do I'll be more proud of.
Well, I appreciate that. It means a lot to have somebody in a position like yours who really cares about the people and doesn't view somebody as just a junkie, and And, you know, I felt that from the first second that I met you, that you treated me like a human being, and that really made me feel good.
Well, I mean, that was just so interesting and so refreshing to me to see the two of you, you know, in what looks like a really meaningful relationship,
Yeah.
talking about stuff that is just so important. Do you want to comment on your relationship with him? What was that? What is that like?
Well,
what was that like for you?
It's meant the world to me. You know, it was an interesting case. The crimes were very serious, but they were very much addiction motivated, and he had no criminal record. So it was one of those cases where you have to strike the right balance between some accountability, but also getting him support and treatment.
Wow.
And we did meet just as you saw in the video. When I met him, I could see that the drugs were shading who he really was.
Yeah.
This conduct was not who he really was. And for him to reach out to me, he reached out to me after his case was over and stayed in touch with me, and we've developed this friendship, and now we're working on what I see as this very important project together. It's probably the most poignant thing that's ever happened to me.
Wow.
So I really love the guy. The relationship means the world to me, and you know, I'm proud that he calls me a friend and that we're working together on this project. And I hope we can reach people and change lives. And his story can change lives.
I think you can,
Yeah.
and I think you can, because there's hope in that. And the hope in that, it's a real deal. It's coming from someone who's seen the other side.
Right.
And is now in a world of health. I think he's been married since.
He's married. He owns a gym.
Yeah.
Successful.
Yeah.
So yeah, I think, you know, let's not be too cynical. Let's not be too negative. We don't talk enough about the success stories, and this story is emblematic of countless other stories. People do come out of this.
Yeah.
And hearing the story is a good reason not to take the first risk in the first place.
Absolutely. And it's also it works against stigma. To see a man like that, a person like that, who had addiction, who got the right kind of help, and became the man he could be.
Absolutely.
You know, I do believe, and from my experience, that, you know, within every person with addiction, there is that great person that can be fulfilling, that can have a life. We just have to learn how to reach them and help them to become the people they can be. And you obviously succeeded in that with him. That connection, that spark of connection. It's a beautiful story. I would look forward to seeing a follow-up a year or two from now. You know, kind of a retrospective follow-up, you know, for the public to see, because, you know, lasting recovery is a beautiful thing. And the way he speaks about himself as a person in recovery.
Right. Right.
Yeah. Do you have any comments on that? What do you think?
No, I think it's a great story. It's a compelling story. So I'm glad that we're shining a spotlight on it.
Yeah, for sure. And I know that you have also, on this other side, the side of prevention and education and helping people to break through stigma, that you've also been active working with high school students. Is that true?
I have, yeah. I've spoken several times since I've been in Vermont to high schoolers across the state, mostly juniors and seniors. But I think it's an important conversation to have, and I find the kids have been a lot more engaging than I initially expected.
Yeah.
I think kids at that age are smarter sometimes than we give them credit for.
Yeah.
So no, it's really been great, and it's something that we look forward to doing more of in the future.
I think it's very encouraging, and I'm with you 100%. Now, we have a short video by Kyle Easton.
Yes.
Is he one of your protégés? Did you work with him? Did you help him do this?
Yes. So this semester, our office challenged his class to produce short prevention videos for social media, and Kyle did a great job on his video. Yeah.
All right. Well, we'll take a look at a clip from that, and then we'll be back to discuss it.
Sure.
But as for the main reason why teens use drugs, based off the data we collected from the survey, is to cope with difficult or stressful situations. Now, there are probably plenty of reasons why a teen would convert to drugs to handle with unpleasant or stressful situations that might be going on in their lives. But a few of those situations might include the likes of depression, anxiety, issues at home or school, or just trying to fit in with your friends. But no matter what caused the person to convert to drugs in the first place, we can agree on this one very fact, that the reason why a person would convert to drugs would be because that there was a need in their life that was not getting met. Well, although many people say that their needs are being met when they take these drugs, what a lot of people forget is that there are post-rush side effects that come with taking these drugs. Some of these post-rush side effects include drowsiness, nausea, an increase in heart rate and blood pressure, anxiety and depression, as well as stroke and even possible overdoses. Another thing that people forget is that drugs just don't affect you in the moment, but they affect your long-term future as well. If you decide to use these drugs or are caught in possession of any of these illegal drugs, it can cost you your money, friendships, academic success, future scholarships to college, your future career opportunities, your current job, and even your life. In 2017, 70,237 people lost their lives to drug overdoses. Will you be next? Now I know that no matter how hard I try to explain the bigger picture to you, it's all up to you of what you do next. On screen right now are a list of mental health and drug abuse hotlines that you can make the choice to call and make the move to get the help you need. Now that you know the bigger picture, you can choose a path, but I hope you choose your path wisely. Thank you for your attention.
Well, I can't even tell you how exciting I think that video is. To have a kid, how old is Kyle, 18?
About 18, yeah.
An 18-year-old kid talking to kids about drugs and the dangers of drugs based in science. You want to comment on that? I just think that's encouraging.
I really think Kyle did a great job, so I commend him for the content of the video. I just think he did great. The editing, I think, is impressive. So, yeah, we're impressed all around with that video. Yeah.
But he actually did the editing and all that too?
He did it all himself.
Oh, Kyle, this is great. This is great. You know, so thank you and your office, both your offices, for really beginning and continuing to focus on this with more and more commitment. This idea of prevention, that's just wonderful. We'll see to it that we can get that as much attention as possible.
Thanks, Ed.
Is he going into law enforcement?
Yes, he's pursuing a career in law enforcement intelligence. So
that's great.
As he says in the beginning of the video. Yeah.
You tell him I say hi.
I sure will.
So, and maybe at the end of the show we can have the links to both those videos for the viewing audience. So thank you so much for being on the show today and sharing so much of what you're about and what your important work is about. I've begun it's become my habit to end the show with my guests making direct comments to the viewing audience. So I'd like to begin to end the show now. And Kevin, I'll give you the stage. I'd like you to make your comment to the viewing audience. What do you want the viewing audience to know?
Well, one message we'd like to get across is, anyone that may be watching this that suffers with addiction should seek treatment in Vermont. There's no waiting list right now. So we value these people. We think that they deserve to be happy, healthy, and deserve to live. So seek treatment. Another message I'd like to get out there is turn in your drug dealer. This takes all of us. This is not just law enforcement. So if you see something on your street or in your community, say something about it. You can report this to your local police station or DEA.gov. We accept tips and we review these tips.
Let me just add something to that, because I think that's really important, that the nature of what is happening in Vermont today is that Vermonters are dying every day. And they're dying from drugs that they're sold very many times by predators coming into the state for profit. The other thing that I'd like to underscore is that sometimes people who are convicted of selling drugs get the kind of help they need more and more. They're exposed to treatment and they're exposed to medication-assisted treatment while incarcerated. So by reporting activity, you know, if you think someone is selling drugs, there's a benefit. There's many benefits. We keep drugs from entering the system, and the person actually selling the drugs may get the kind of help and attention that they need. And Christina, would you like to talk to the audience?
Sure. I was at a conference on opioids in Boston, a regional New England opioid conference. There was a day devoted to law enforcement, and there was a day devoted to treatment and prevention. And I was talking to some of the clinicians involved in the treatment side, talking to them after their panel, and they said, we are living in a special time when U.S. attorneys and law enforcement, treatment providers, people in prevention are at a conference together, talking to each other, working toward the same goal, which is to save lives and break the cycle of addiction and get people into addiction-free lives where they can live out their hopes and their dreams. And it's going to take all of us. Law enforcement is part of it. We're in law enforcement, but we're also working in prevention because we know it takes supply and demand reduction, and it takes a multidisciplinary, holistic approach. It takes all of us, everybody in every profession. And I think, being a hopeful person and wanting to spread a message of hope and seeing that we are seeing some good signs in opioid overdose death data, some reduction. I am hopeful that this is a special time and we're seizing the moment and we're going to continue to make progress.
Thank you. Seizing the moment. Thank you.
All right. Thanks for having us.
Thank you for being on the show. Really. Thank you.
Thank you.